Good morning, everyone.
Good morning.
Good morning.
My name is Gary West. I'm the State Fire Marshal, Deputy Commissioner of Fire Prevention, and I'm glad everyone's here today. This is our annual fire prevention kickoff for the state of Tennessee. This is the day that we kick off all of our programs for the next 12 months, and we work with our local partners and stakeholders, and as well as their state and federal partners. We appreciate everyone being here today, and I'd like to welcome the media and the partners. I want to thank the State Parks Department for allowing us to use the Bicentennial Park. Our plan today is to have this area here full of fire prevention activities, as well as a bouncy house and a lot of other fun things for kids. Typically on this day each year, we have a lot of kids coming through the area, and it's always a big event. The weather was something that we kind of planned around and decided to scale it back a little bit because of the some of the people traveling so far. So a lot of our partners are not here today, but we want to recognize them and thank them, even though they couldn't make it. This coming week, starting October 5 through 11, is the National Fire Prevention Week. The theme this year is Working Smoke Alarms Save Lives. Test yours every month. And I'm going to say that in Tennessee, this is a big message for us, and we've been working on a smoke alarm program now for quite some time, and we have some really good results from that. The sad part is, though, is that 98 Tennesseans lost their lives last year in unintentional fires. This year, to date, we've had 49 fire fatalities. 70% of the fire fatalities in 2013 occurred in homes with no smoke alarm or no working smoke alarms. We have documented this year 60 lives saved through our statewide Get Alarm program. 380 fire departments and organizations participate in this program, which provides 10-year battery smoke alarms for installation in local communities. We've installed close to 52,000 smoke alarms in communities across Tennessee, and that's with the help of our partners. We could not do that without their help. We want to remember those victims that have died or have been injured in these fires, and we want to think about the lessons learned from these things. And behind us up here is a few examples of that from around Tennessee. Our plan today was to put these posters here out on the state map, out on the plaza, and to show across the state where these things have happened, because if we educate people, hopefully we can prevent them from happening in the future. So when this is over with, please feel free to come up and look at these. The weather today just didn't participate with what we had intended to do. Our new campaign for this year and our program that we will be pushing for the next 12 months include what we call Close the Door. And you can see here we have our door up here, and in an effort to save even more lives from fire, we're encouraging Tennesseans to close the door. A door is one of the best pieces of firefighting and life-saving equipment. Simply the act of closing a door reduces fire growth and spread, limits damage to your home, and could possibly save lives. If possible, sleep with the bedroom door closed. If you have to leave a room that is on fire, simply closing the door behind you can be the best decision you make. And we're going to be pushing this program across the state. And I think that in recent time we've had a tremendous amount of research showing that If the door is simply closed, that the fire will stay in that room. It takes a long time for the fire to burn through a door. Sleeping at night with the door closed to your bedroom could be the difference between life and death. And by keeping that fire in the room where it started, and as we call it in the fire service, room and contents, is where we want to keep that fire at. So this is our new program, and if you look at the door, we have some safety messages on one side where the fire is, and on the other side we have talking about what could happen and the temperatures and the things like that. So again, I want to thank everyone that came in, and that is where we're going to this year. Now, to be successful in our program, we have to have our partners with us, and it's my pleasure to introduce one of our partners, and a very important partner. And this group treats and handles patients from fires and deals with the fire problems after the fact. So I want to introduce to you Dr. Lisa Ray with Vanderbilt Burn Center. She's a surgeon there.
Hi, I'm Lisa Ray. I'm one of the burn surgeons at Vanderbilt University Hospital. And we really are dedicated at Vanderbilt not only to give the best medical care, which extends far beyond treatments of the burns at Vanderbilt, but really to reach out to the entire community that may at some point need our help. And that includes education, fire prevention. We do a lot of outreach and education to our pre-hospital personnel and the emergency departments around the state to make sure that if you're in a fire and have a burn in Chattanooga or anywhere else that's going to funnel into our center, that you're getting the best care from the moment the pre-hospital personnel, EMS and firefighters are able to reach you. And so that we have optimized our healthcare all the way in to Vanderbilt. And it extends far beyond that. When patients get burned, they not only undergo repeated wound care, burn surgeries, very high risk of pneumonia with or without an inhalation injury. The body's reaction to the shock of a burn puts them at risk for infections all over their body. And treating these people and getting them through to survival is extremely challenging, and a challenge that we embrace and hope to give the highest level of care and continue to push the envelope of new innovation to help these patients. But even after their burns have healed, we've gotten them grafted and they're leaving, there's a long course for these patients. They need to go back to their homes and participate in rehab for 6 months to a year to help with scars and mobility across their joints. Their scars are remodeling for at least a year. They need compression garments that change with weight gain, weight loss, and changes in mobility. Those need to be updated. And chronic pain. These patients have chronic pain for at least 3 years, sometimes after a burn. And so we do look to educate the rest of our community even after they leave Vanderbilt Hospital to help us give these patients the best outcome we possibly can. So we are a comprehensive center that not only worries about the operating room and the ICU, but treating these patients far beyond. And certainly one of the biggest components that we can never forget is the emotional expense on the patient and their families to help them get through these tragedies. They're really so taxing. It's a life-changing event to have a major burn. The person you were is, even if you can go back to the same activities you were doing, you will never be the same. And so helping these families through this, helping the patients find their way back to life after this is an amazing challenge, and it's far reaching beyond the walls of our burn center. And we want to make every effort to reach out and help our communities treat these patients as well as we can and get them back to life. So we've talked about some of the Tennessee statistics, and the great news is we're doing better than the nation in a lot of these areas. Over the last 30 years, from the 1980s to now, deaths from house fires and deaths from burns are down 50%. It still only gets us from somewhere in the high 700,000 deaths a year to the 370,000 deaths a year still occur annually in this country from fire. So we're making progress, but we have a long way to go. So that averages out to 7 patients a day die in this country from a fire. So still a lot of progress. I think in a lot of ways we're doing much better. Nationally, 40% of patients who die from a house fire have working fire alarms. So 60% still nationally don't, and we're working on making that better. Thank you very much. So I will turn it over to
Coming
Chief
back.
DeShields. You coming back? All right. Thank you so much.
Appreciate those words, and that's exciting to hear you speak and talk about the patients and things like that. I think that the victims in fires sometimes, as a firefighter, I know that we go out and fight the fire and we have those victims on the scene and we get them out of the scene, and then many times we don't hear about how that treatment is went or when they're back, and it's over long periods of time. So that's important to hear that. It is my pleasure now to introduce to you all a local fire chief with the Manchester Fire Rescue, Chief George DeShields, and he's going to talk to you about the local things that they've been doing for fire prevention and their efforts.
Thank you. Good morning. I just want to talk a little bit about the Get Alarm program, what it's meant to our community, and what it means to us as firefighters. Manchester Fire Department and other departments statewide have partnered with the State Fire Marshal's Office with the Get Alarm program. We've received free 10-year smoke detectors, smoke alarms, to distribute and put out in homes all through our community. We've gone into so many different homes in our community, a couple hundred in the last year alone, and we found a large need for these detectors where people don't have the financial ability to pay for their detectors themselves, or the homes are very old and they just don't have the detectors or alarms in the homes. So we've been able to go out and provide this invaluable resource because of the donation of those, or the grant that the State Fire Marshal's Office received. About 2/3 of the fire deaths occur in homes with no working smoke alarms. Properly installed and maintained alarms are one of the best and least expensive means of alerting your family and providing early warning of a potential deadly fire. And it also could help reduce the risk of dying from a fire in your home by half. Properly working smoke alarms alert the family and give them the extra seconds that they need to get out of the home and make it outside safely. What that does for us as firefighters is it allows us, when we arrive on the scene, to concentrate our efforts on fighting the fire and not rescuing the family or the family members that are still inside the home. So we can take our focus, put it solely into the firefighting effort, knowing that the families are outside safe from that working alarm. Our number 1 priority as firefighters is life safety. We place our lives on the line constantly, and we'll do that for our community every day. There's a way to help us, and that's by having working, properly installed smoke alarms in your home. Every 10 seconds in the U.S., there's a structure fire, a home fire, and just the simple installation of an alarm could help reduce the risk to yourselves and to the firefighters when they arrive on the scene. That, with a practice escape plan, can help you help the firefighter. So we ask that you help us, and we'll help you. Thank you.
Very good. Thank you, Chief. I want to introduce to you now a partner that we have been working close with in recent time, and we have a huge program that we're working together on as we move forward this year. I want to introduce to you Andy Perelman, who is with the Red Cross.
Good morning. My name is Andy Perlman. I'm the Regional Manager for Mass Care and Logistics for the Tennessee region. Fire prevention and preparedness is everybody's business. Our communities across the state are diverse, and some of the best ways to increase fire prevention awareness and reduce fire fatalities is through the establishment of community and government partnerships. The State Fire Marshal's Office has embraced this, and as a result of our shared mission, they have been working with the Red Cross to do just that. The Red Cross has embarked on a national fire preparedness campaign. Over the next 5 years, Red Cross volunteers will be canvassing high-risk neighborhoods, installing smoke detectors, smoke alarms, and conducting home fire safety checklists with the family members. Determining those highest risk neighborhoods came as a result of working with our fire departments and information and resources from the State Fire Marshal's Office, and we thank them for that. As part of this program, we'll also be engaging children in schools. Our goal is to install 500,000 alarms and reduce fire fatalities and injuries by 25% over the next 5 years. Another project that we are partnered with the office is an event that is on December 6th. The Red Cross and the State Fire Marshal's Office are co-hosting an event specifically geared around the fire preparedness challenges of the deaf, hard of hearing, and deafblind communities in Tennessee. This accounts for almost 20,000 individuals in Davidson County alone, and at least 50,000 people across Middle Tennessee. The State Fire Marshal's Office will be conducting an educational program that is accessible to these individuals through the use of sign language interpreters and a captioning provider. This really demonstrates the willingness of the State Fire Marshal's Office to be totally inclusive and provide educational programs for the whole community. We thank them for that. In addition to planning and preparedness, the Red Cross also responds to home fires. We respond to fires with our volunteers when people are displaced from their homes, and our disaster action teams provide food, clothing, and shelter for people that need it. That financial support comes 100% from the donor dollar, and these services are provided by volunteers 24 hours a day and 7 days a week. With that, turn it back to Commissioner West.
I say, wow. I feel like that our partners are the key to being successful in what we do. I want to thank you all for participating this morning and coming out, because each one of you have said some really good things that we have to work on this coming year. We want to remind Tennesseans about the importance of smoke alarms, about checking those batteries if you have the battery smoke alarms. We want to promote the 10-year technology and the batteries that, or the smoke alarms that you don't have to replace the batteries in every 6 months. We want to remind people to test their smoke alarms. We want to ensure that people close the door before the fire, or if there is a fire, close the door behind you to slow the fire down and to save your property and lives. And I want to say one thing that our research and things have told us here in recent days, actually, that in the past 3 years there's been a 23% reduction in Tennessee fire fatalities. And this is the greatest reduction in state record. I think that effort has been from the partnerships and the working relationships that we have made and that we continue and that we strengthen each day. I want to say thank you to our staff that came down this morning and participated, our bomb and arson agents who investigate fires every day throughout the year, our State Fire Academy for their education that train firefighters and to promote fire prevention. I want to say a special thank you to the Brentwood Fire Department for today bringing our, to our program a state-of-the-art fire safety trailer. It's outside, and we encourage people to go out and look at it. And I also want to make mention about our federal partners involved here too. Michael Knight is here this morning with ATF. He's always a good partner in everything that we do. So I want to say thanks to everyone involved. And if anyone has any questions, I guess we would open up to questions at this point, if there are any. All right. Thank you all.